Doctor, let us go into the diagnostic terms that were taken up on direct examination. Very well. There are certain conditions of the external ear that I would like to know about. Well, they are the abscess of the auricle or of the external auditory meatus. Is that a localized collection of pus, doctor? Yes, a collection of pus of the auricle or meatus. Doctor, is there any congenital or acquired defects in this patient? Well, the atresia of the external auditory meatus, which is the absence of the normal opening of the ear or closure of the external auditory meatus, means that there is a congenital microtia. And doctor, it is usually a deformed or misplaced small oral tag associated with absence of the meatus and the tragus? That is correct. It is a traumatic avulsion of an auricle. Does that mean a loss of pinna due to injury? That is correct. And doctor, dermatitis of the external ear is inflammation, is it? Yes, inflammation of the skin of the auricle and external auditory meatus. What are the types encountered? The types are dry, moist, exfoliative, contact, eczematous, allergic, and seborrheic. Doctor, frostbite of the auricle is a serious condition, is it? Yes, it is. What does it result from? It results from the exposure to extreme cold, resulting in hyperemia, blanching, and, in severe cases, in ulceration and gangrene. Doctor, the furunculosis of the external auditory meatus is usually what? It is a mild infection of the sebaceous cysts and glands and hair follicles, which tend to develop in debilitated persons. Doctor, herpes zoster of the auricle is what? Herpes zoster of the auricle is an acute inflammatory condition characterized by blister formation along the distribution of the sensory nerves. Doctor, leprosy of the auricle is possible, is it? Well, it is usually infiltrative, ulcerative, and nodular as to lesions of the ear due to Mycobacterium leprae. The lobe of the auricle in the site of predilection is the perichondritis of the auricle. Doctor, could it be an inflammation of the membrane of the fibrous connective tissue around the cartilage? Yes, and that is marked by exudation, thickening, and shriveling. And tumors, doctor, of the external auditory canal may be implicated? Yes, the adenocarcinoma of the cerumen gland. It is a malignant tumor originating in ceruminous glands, which are characterized by a tendency to invade soft tissues and bone and recur after surgical removal, in my opinion. Doctor, the mastoiditis is an inflammation of the mastoid, is it? Yes, an infection of the middle ear which has extended to the antrum and mastoid cells. Does mastoiditis, doctor, come in an acute form? Well, it is usually subacute, chronic, and recurrent. And the middle ear effusion, that is an acute or chronic presence of fluid in the middle ear, generally without infection. Doctor, the otitis media, mucoid otitis media, or glucotitis is what? That is a thick, cloudy, viscous exudate in the middle ear containing cells and mucus strands. Doctor, the serous otitis media is thin, is it? Yes, it is thin It is clear amber fluid in the middle ear. And serous otitis media with hemotympanum, that is a serum and blood in the middle ear space resulting from temporal bone fracture, tumor, or blood disorder. Doctor, the otitis media is what? It is an inflammation of the middle ear. Common types encountered are acute suppurative otitis media, marked by intense congestion of the mucus of the middle ear, blockage of the eustachian tube, serous exudate, which becomes infected and ruptured with respect to the eardrum. Bacterial invaders are Staphylococcus aureus, Diplococcus pneumoniae, Streptococcus pyogenes, and Haemophilus influenzae, and others. Doctor, the chronic suppurative otitis media is characterized by what? It is characterized by the continuation of the middle ear infection resulting in protracted suppuration. Doctor, the salpingitis of the eustachian tube is an inflammation, is it? Yes, it is an inflammation of the auditory tube. It may be acute or chronic. And doctor, the conditions of the inner ear are what? They are acoustic neuroma, benign tumor of the 8th cranial nerve, affecting more the vestibular branch than the cochlear branch of the nerve, and causing vertigo, tinnitus, and hearing impairment. What is labyrinthitis, doctor? Labyrinthitis is an inflammation of the labyrinth, usually secondary to acute or chronic suppurative otitis media with or without cholestoma, or to acute upper respiratory infection. Doctor, Meniere's disease is what? Meniere's disease is an endolymphatic hydroma. Is it neurologic? Yes. It is a neurologic disorder in the classic form, exhibiting a triad of symptomatology. Doctor, may there be explosive attacks of true vertigo vis-a-vis Meniere's disease? You are on the ball with respect to that statement, sir. Yes, the answer to the question is yes. And what about microsurgery of the ear? The use of a high-powered binocular dissecting microscope with built-in illumination in the ear operations is mandatory. And otogenic complications arise, do they? Well, there can be a brain abscess, a sequela of chronic suppuration of the ear, often an otitis media. Got quite a few misspellings here. Surprised. A sequela. It's sequelae. Sequela is one. There's not one. He says there are many sequela. Can't say there are many one. There are many sequelae. A-E. How's that? You got all that in your dictionary?